Hi, my name is Patrick and today I'll be going over how to properly assess and measure blood pressure. We will be using a properly sized blood pressure cuff with a manual working bulb and valve, with a stethoscope to hear choral cough sounds as pressure of the cuff is released. There are two measure components of blood pressure, which are systolic pressure and diastolic pressure. Systolic pressure being the highest pressure during contraction of the heart and the first choral cough sound you will hear. Diastolic pressure is the pressure in the arteries between heartbeats when the ventricles are being filled with blood. This will be the last faint choral cough sound you will hear. The units of measure are millimeters of mercury. Pre-assessment. It is important that your client is clearly instructed to refrain from any caffeine or nicotine products at least 30 minutes prior to testing. We will start by having the client seated in a rested position for 5 minutes with their back supported, feet on the floor, uncrossed, and their left arm elevated by the level of their heart. It is important that we have a properly sized cuff for our client and that the cuff be placed over their bare arm right below their deltoid. We will grab the blood pressure cuff, place it on the table so that the artery marked line is facing you and you could direct it towards the patient's brachial artery. Once you're in the correct position, grab the deflated end and strap it over the patient securely. Place the blood pressure gauge in a location that you will be able to see the measurements. Locate the valve on the bulb and be sure that it is turned all the way towards the right so that you can properly inflate the blood pressure cuff. Now grab your stethoscope and be sure that the ear prongs are facing outward like this and not inward. You will then support the stethoscope diaphragm end with 2 fingers between the smaller end, which is called the bell. Here we are placing the diaphragm right below the brachial artery and making sure it is not under or inside the cuff. With the valve turned all the way towards the right, we will then be able to press on the bulb to be sure to inflate our blood pressure cuff to 180 millimeters of mercury. We will then carefully release the valve towards the left at a rate of 2 to 5 millimeters of mercury per second. As the pressure is being released, it is important that you listen for the 5 choral cough phases. This will consist of a clear tapping sound signaling your systolic number, a swishing noise followed by a crisper and louder tapping, a blowing sound, and lastly silence, which signals your diastolic number. The measures will always be even numbers and the time frame to wait between readings is between 3 to 5 minutes. Here is a chart displaying the different blood pressure categories where our client fell between the pre-hypertension values of 120 to 139 systolic and 80 to 89 diastolic millimeters of mercury.